Hi and welcome back all of you for the next lecture on microbiology. And today's topic of discussion is going to be the Corynebacterium Diphtheriae, which is a gram-positive bacilli. Now we are shifting or we are switching from cocci to bacilli. Okay, so cocci means round shaped. So which all cocci did we study so far? We studied gram-positive cocci, we studied gram-negative cocci also. Okay, so gram-positive was which? Streptococci, staphylococci, pneumococci. Gram-negative cocci was Neisseria gonococci and Neisseria meningococci. Now we are shifting into bacillus, which is rod-shaped. Okay, the other one was round. Now this is rod-shaped. Okay, gram-positive bacillus. Still we are in the gram-positive. So gram-positive, gram-negative, again gram-positive. Fine. Okay, so please note, very important, that these are gram-positive cocci. Okay, sorry, gram-positive bacilli. Gram-positive bacilli. Now, how did this name come? Corynebacterium Diphtheriae. So this coryn came from the club shape. We'll soon see that the shape of the bacterium is a coryn, like a club shaped. Okay, I'll show you what the club shape is. And diphtheriae means, okay, it's diphtherios. The term comes from the term diphtherios. Diphtherios. And basically, you know, it causes a disease called diphtheria. It's a kind of pharyngitis, or it affects the respiratory tract. Okay, laryngitis and pharyngitis. Now, diphtherios means leather. Okay, leather. Now, why leather? Because this causes a very important disease, which leads to pseudomembrane formation. Okay, which leads to pseudomembrane formation. We'll study a little bit of details onto that. Okay, pseudomembrane formation. And due to the consistency of the pseudomembrane, which is a membrane where the disease is affected, due to consistency of this membrane, which is a leather consistency, it's called the diphtherios. Okay, diphtherios. Fine. And it is also known by a name called Klebsiella. Okay. Klebsiella bacilli. Okay, Klebsiella bacilli. Why this name? Naturally, these were the scientists involved. This was the first person who observed it under microscope, and he was the first person who cultivated it. Okay, cultivated it, or cultured it, you can call it. Okay, who first cultivated it. So it's a gram-positive bacilli. Coryn means club-shaped, we'll see soon. Diphtherios means leather, consistency of pseudomembrane, so that's the naming. And Klebs means it's like, it's Klebsiella bacilli, okay, because it's observed and cultivated by these people. Now, the way you learn it like this, it will stay there, isn't it? What is Corynebacterium Diphtheria? Now you revise it, it will be much more better for you to learn this Corynebacterium Diphtheria. And next, let us go on to the next part, which is going to be the morphology. It's very important to understand the morphology of this bacteria. Fine. Now in morphology, you have to know that it is rod shaped. Okay, it has got a rod shape with clubbing at one or both ends. So it's basically like this. It's a rod shaped bacteria. Okay, with clubbing at one end. Okay, let me use, it's actually, the color of this clubbing is kind of this dark purple. Okay, clubbing at one end, or it can be clubbing at both ends. So this is rod-shaped bacteria with clubbing of this sort. Now, when we discuss, we call it as pleomorphic arrangement. Okay, we call it as, or we name it as having a pleomorphic. What is pleomorphic? I'll just rub this. Pleomorphic means it has no specific shape. It can be any shape. Okay, pleomorphic arrangement. And the arrangements, okay, the arrangement of this pleomorphic bacteria can be either, as I've told you, club shaped, or it can be random V or L letter pattern. Okay, V or L letter pattern. Now, what is the reason? I told you, what is the reason of this club shaped? It is presence of granules on the either end or both the ends. And what is the name of these granules? We'll go into the pictures of this very soon. Okay, it's called metachromatic granules. Metachromatic because of this chromatism or the color. Okay, or it's called volutin granules. Volutin granules, or it's called Babes, Ernst granules, or it's called polar bodies. Polar bodies. Okay, polar bodies. Now, what is the role of this basically? Now, it's a very important identifying feature, and also this has got polymetaphosphates in that. Okay, inside they have got polymetaphosphates. Okay, it contains polymetaphosphates, and which is a energy storage. Okay, for their energy, like we store glycogen, they store polymetaphosphates for energy. Okay, we convert glycogen to glucose. Okay, similarly, they store polymetaphosphates in these granules, metachromatic, volutin, Babes, and polar bodies. It in itself is an MCQ. Okay, now, not over yet. If you come on to the V or L, they call, like, it's V or L pattern because it's like, it's randomly arranged. Okay, so, and it's called Chinese letter pattern. Chinese letters are randomly arranged. Chinese letter pattern or cuneiform arrangement. Okay, cuneiform arrangement. So these are the morphology which you have to learn. Okay, one is club shaped, as we've seen, or V or L shaped. V or L shaped is Chinese letter or cuneiform arrangement, and these are club shaped because of this granules, which is storage form of energy in the form of polymetaphosphates. Okay, polymetaphosphates. Done. So that's all about the morphology. I'll show you the image of this very soon. Okay. Next, come on to the pathogenicity. Very, very, very important. Okay, very important because we are learning about diphtheria. Now, you will be thinking, why? Now, microbiology, a subject which we didn't concentrate at all while we were studying MDS, isn't it? But, and also, only 7 marks questions from here. Why is so much time being put into this? 2 reasons. 2 very important reasons. One, as I've told you, many basic understanding comes here, like general pathology, where lots of basics come, but a very, very unimportant subject, or I would say not very important subject, not unimportant, not very important subject. So similarly, it's basics, lots of basics come here. One. Second, bacteriology can be asked in any medical subject. For example, 15 questions come from general medicine, so they can include it there. They can include it in general surgery. They can include it in oral pathology. They can include it in oral medicine. Even some parts can be included in periodontics and oral and maxillofacial surgery. Fine. So that's why so much importance is given to the microbiology and especially the bacteriology. And yes, when it comes to immunity, you have to learn lots of basics things in there. Okay, because for example, lots of hypersensitivity reactions. Now, why Corynebacterium diphtheria is important for dentists? Because it involves maxillofacial region. Now, still again, are you going to treat it? No, but here comes some complications, which includes asphyxia, breathing difficulty, which is associated with diphtheria, and there are dental conditions, especially space infections, which we'll study in maxillofacial surgery, which has got its connection with, which can lead to which can lead to the problem of breathing difficulty, okay, asphyxia. There are lots of space infections, especially Ludwig's angina, retromandibular space, retropharyngeal, okay, lateral pharyngeal space infections. So all this can lead to the problem of breathing difficulty. So you have to identify or you have to recognize it is not Corynebacterium, it is space infection. So if you want to differentiate between that it is not Corynebacterium, you should be knowing about Corynebacterium diphtheria, isn't it? Simply just knowing the space infections will not solve your problem. So that's why it is important. Okay. So now next time when someone tells you Corynebacterium is not important, tell them no, it is important for dentists. Okay. This is what I'm going to change. I'll try to change. Look at this perspective, because people think initially no one is there to tell also in the community. So at least those in the Dental MAs Academy, tomorrow you become professors in any department. Okay, because you go to study PG, you become professors in any department. You should tell your students that nothing you are learning, I would say 90% of what you are learning in your medical, okay, including your biochemistry. People say that why do you want to learn biochemistry? Including biochemistry, I'll tell you why. Okay, when we'll reach there, including biochemistry is important for dentists, is very important for dentists. Okay, so there is nothing you are learning, maybe 10 to 15 to 20%, but 80%, let us take it as 80%, at least 80% you are learning with a purpose. Okay, fine. So let us come on to the pathogenicity, and definitely the pathogenicity involves diphtheria. So we're going to discuss in detail about diphtheria, which is systemic infection. Also, there is cutaneous diphtheria, which in fact is not related to systemic, it's just onto the skin. So we'll discuss both a little bit. Fine. Now, the most important thing which you have to know here is exotoxin. Okay, I'll just, because you will need more space. Okay, so I'll just write it here. The most important thing which you have to know here is exotoxin. If you know exotoxin, you know diphtheria. Okay, if you know exotoxin, you know diphtheria. It is not the invasion of this bacteria which causes the disease, like others. You know, like others, how do they cause disease? They invade the body, they play with the immunity, isn't it? They play with the immunity, or they cause inflammation and they cause disease. Here, it is not at all like that. It is basically the exotoxin. Why it is so important? Because if you are treating the bacteria, if you are killing the bacteria, still the disease will not go. Because you killed the bacteria, but you have not destroyed the toxin. Okay, so you need to, while treating this disease, you have to kill the bacteria and you have to also neutralize the toxin. That's what the treatment of diphtheria is. And that's why I told you, if you know the exotoxin, now why exotoxin? Because it's a gram-positive organism. When you come on to gram-negative, it is endotoxin, which is lipopolysaccharide. This is exotoxin. Okay, if you know exotoxin, you know the diphtheria. Okay, fine. So exotoxin has got two fragments. Now we're going to go into a little bit details of this. It has got two fragments, fragment A and fragment B. Okay, and please note the fragment A, both of them are important in pathogenesis, but the key here is this has got enzymatic activity. Okay, this is the part which has got the enzymatic activity. What enzymatic activity? I'll tell you. Okay, and this part helps in adhesion of the toxin, not the bacteria, adhesion of the toxin to the receptors of the cells. Okay, or binding of the toxin to the receptors of the cell. Okay, binding of the toxin, adhesion or binding of toxin. Now, let me just tell you a little on this first. Why is it important? Adhesion. Now, if you can find out a mechanism which prevents this adhesion, action of toxin can be prevented, though it has got an enzymatic activity. So it's much more easier to treat the disease if you can prevent the adhesion of the toxin to the cell. So what usually antibodies or antitoxin does is they inhibit this adhesion. It's important to understand here a little concepts. Okay, so where do antibodies act? On fragment A or fragment B? They act on fragment B. Or where do antitoxin act? What is the name of antitoxin of diphtheria? It is antidiphtheritic serum. So where do they act? They act on the toxin. Fine. they act on the adhesion or the binding of the toxin. Book says, let that be the term, the binding of the toxin. Okay, binding of the toxin to the receptors. Which are the receptors? I'll tell you very soon. Fine. Okay, so we're coming back to the enzymatic activity. Okay, enzymatic activity. What is the enzymatic activity? We're going to discuss here. What does it do? It inhibits, okay, it inhibits polypeptide chain elongation. Polypeptide chain elongation now. Elongation. If polypeptide chain elongation is inhibited, it inhibits protein synthesis. Protein synthesis. And if protein synthesis is inhibited, what are our enzymes? What are our immunities? What are all these things? These are basically all these are proteins. So if our body cannot, or a particular cell where this toxin is affected, if it cannot produce protein, means our immunity is going to go down. Our body cannot respond. Okay. So now, as I've told you, the previous slide, biochemistry is important to us. And where are we going to study about protein synthesis? In biochemistry. A part of protein synthesis is polypeptide chain elongation. What is peptide? It's a bond. So multiple peptide between the amino acids forms a protein. So its polypeptide chain elongation is inhibits the protein synthesis. Now it's important, as I've told you, this acts on a receptor. Okay, this acts on a receptor and it inhibits a particular gene. Okay, so what is the name of the receptor? Okay, I'll just write it here, receptor. Just write there, receptor, and the name of the receptor is, and here it is going to be gene. Okay, gene. So the name of the receptor is CD9 and HBEGF, like receptor. Okay, not very important, but the most important is where it acts on, or where is the action on EF2 gene. EF2 is elongation factor 2 gene. Okay, polypeptide chain elongation, so elongation factor 2 gene. So where is this enzyme attaching to? It's attaching to this receptor. Through, who helps? This helps. Once it is attached, it's going to inhibit the gene EF2 gene. EF2 gene is inhibits the polypeptide chain elongation. If that is inhibited, protein synthesis is going to be inhibited. Now, there is another bacteria which has got a similar mechanism of action which inhibits protein synthesis, which is Pseudomonas aeruginosa. So, we are going to study, okay? Pseudomonas aero, very important infection, okay, for anyone working in hospital. Pseudomonas aeruginosa. Okay, now, so don't dentists work in hospital? Yes, they do. So now let's inhibit protein synthesis, similar mechanism. So once again, what is going to happen here? It's exotoxin. A and B, two fragments. B helps in adhesion and antibody acts there, preventing the adhesion. Okay. Now enzyme A is enzymatic, inhibits the polypeptide chain elongation, thereby inhibiting protein synthesis. And the receptor is this, and more importantly, they have asked you this, what is a gene effector, or what is the site of action? It is EF2. The same mechanism is there for Pseudomonas aeruginosa. Okay. Now, little bit more details, because this is so important. This is very important. So now, the lethal dose, okay, lethal dose, it's a very potent toxin. So even a small dose enters into the body, it can kill the organism, which is the lethal dose. Lethal means the dose which can kill the organism, which is 0.1 microgram per kilogram. Yes, one new book for values, okay, values, 0.1 microgram per kilogram. Now what the people who create vaccines, what they do is, for this diphtheria, they take the toxin, okay, and they make it as a toxoid. Toxoid means what? The toxoid means it's a toxin which has no virulence, it can't cause any disease, but it has got immunogenic properties, means if it goes into the body, it can produce antibodies. So the strain which is used for this purpose, that's what I want to tell you, for toxin production, it is Park William 8 strain. Okay, Park William 8 strain, okay, which is used for toxin production, for vaccination, and toxoid it or make it avirulent. Okay, now one more thing, these toxins are not produced by all strains, it is produced only by lysogenic strains. Okay, these are produced only by lysogenic strains, and you know now what is lysogenic strains, where bacteriophage transfers the virulence from one bacterium to another, and it can cause the or it can make a non-virulent bacteria into a virulent bacteria. This is known as what? Phage conversion. Phage conversion. Phage conversion. And this phage conversion is due to transfer of which gene from one bacteria to another? It is Tox plus gene. Okay, it's Tox. Okay, Tox plus gene or Corynephages. Corynephages, easy to remember, isn't it? Corynephages. Okay, got it. Only lysogenic strains produce the toxins or these toxins, and it's called phage conversion due to the presence of the gene Tox plus or Corynephages. Okay, Corynephages. Now, toxin production is influenced by the presence of iron. Now, if there is iron in the body, definitely it is going to be, it can influence toxin production, but not the same way, or it depends upon the concentration of the iron present. If the concentration of iron present is 0.1 milligram per liter, it's going to be a different effect. If it's going to be 0.5 milligram per liter, it's going to be another or a different effect. This favors, or this is optimal concentration, again values, and this inhibits vertical learning. 0.1, 0.5. Optimal inhibits. So it's you're comparing two values right away. You're not going like this. You're not going 0.1 to optimal and 0.5. You forget it. Okay. So 0.1, 0.5 optimal inhibits. Okay. 0.1 milligram. So again values. So again we have studied two values now. Lethal dose is 0.1 microgram per kilogram. The iron concentration is 0.1 milligram per liter. The unit also varies there. Okay, unit also varies there. So lethal dose is 0.1 microgram per kilogram. The strain which is used for toxin production is Park William 8 strains. Lysogenic for phage conversion happens, then only toxin production occurs. Due to the presence of Tox plus gene, iron concentration or influences the production of toxin. The optimal toxin production occurs when there is 0.1 milligram per liter of iron, and it decreases if iron concentration increases, which is 0.5 milligram per liter. Okay, so that's about the pathogenicity. So what did we learn about pathogenicity? Basically, we learned about toxins, its action, its concentration, how it acts, and everything. Okay, now we will go on to the clinical features of diphtheria, because that's, and we'll discuss about, yes, cutaneous diphtheria and systemic diphtheria. Okay, not in pathogenicity. Here is what we are going to discuss it. Okay, here is what we are going to discuss, the clinical features. Okay, or cutaneous or types of diphtherias, and cutaneous diphtheria and systemic diphtheria. Fine. But before going on to the clinical features, I want to discuss something with you, which is very, very, very important. Okay, so that is the learning pattern. Many people, okay, many students come to NEET MDS preparation from their BDS years without knowing the learning pattern of NEET or INI-CET, and they have problem of learning. Okay, they just confuse themselves, and finally, what is the outcome all the time? Most of the time, they leave in between. They don't even complete their coaching program. So it's very important for you to understand the learning pattern. Now, the learning for NEET MDS or INI-CET, when I say NEET, it is also INI-CET. The learning for NEET is not going to be like one-day learning or two-day learning or one-time learning. You are not going to learn everything in the one go. You know it. Okay, so it's a multiple kind of learning, revision, lots of components are going to get into that. It's very important. Please listen to this. Okay, don't fast forward this. It's crucial. The most crucial thing you're going to learn here. Fine. So the learning pattern, initially what you're going to get lectures, isn't it? You're going to get lectures. So, or notes at times. There is no lectures, means there will be notes provided for that particular topic. Or at times both lectures and notes. For some subjects, especially the clinical subjects, you'll get lectures and notes. Okay, because certain areas, in-depth understanding is required. So, you get lectures plus or minus notes. Okay, what do you get next? What do you have next? You have got the MCQ book, dental dentist or any other book which we tell you, okay, the question bank. Then you get the academy questions, topic wise, okay, academy questions, topic wise questions, okay, topic wise questions. Then you get subject wise test paper, subject wise test paper by the academy. Then you get grand test. Not over, it's there, but this is the first phase. The second phase is going to be revision. Okay, continuous revision strategy, which I'll tell you later on. But here, when you are going to get your lectures or notes, when you are listening to lecture, you are taking down notes. While taking down notes and listening to lectures, you're only going to learn 20% of it, or you're going to you will understand everything, but you're going to retain. If you just keep your book there, you don't take it then, okay, then you're going to for the next topic, you're only going to retain 20% of it at a later phase, or even lesser, okay, or even lesser. Fine. Now, the same day, for example, same day, you're going to take your MCQ book, solve your dental pulse. So you have listened to the lectures, you've taken down notes, you have run through the notes. Okay, what you have taken down, you run through the notes, then only come to MCQ book. Don't just write down notes and jump onto MCQ book. Just see what you have learned once and then come. Take 10 minutes. You've solved MCQ books, you're going to learn 10% more because you're learning for an MCQ based exam. You have to do the MCQ based questions, definitely, no doubt. Okay, now, is it over? No. Here is what you are going to understand, where to concentrate, the importance of each topic. Why am I saying this? Now, you go through the lecture, you understand the lecture, you don't know what exactly it's going to come from diphtheria. What are the questions asked? You don't know. Yeah, in between I will tell you this is the question, this can be the question. But when you go through the MCQ books, you will understand the importance of a particular topic, where exactly to concentrate, So far only 30% learning has taken place. Okay. Then, for example, just imagine, hypothetically, you are doing the topic wise test paper. Now for a long topic like bacteriology, you will get your topic wise test paper little delayed, isn't it? So, but still, you're getting topic wise test paper. Just imagine the same day, hypothetically, for smaller topics and all, you're doing the topic wise test paper, you're going to learn 10% more. Okay, you're going to learn 10% more. And here, what are you going to understand? Here, you start thinking, you're going to get new questions. You're going to get new questions, you're going to get questions where options have changed, you're going to get questions where a little slightly different, changed pattern of questions, or the same question has been modified a little bit kind of question. So this is where you start thinking, okay, in your MCQ book, you thought like this, and now you're getting new question, you start thinking, plus you have learned 10%. Now here, imagine you finish as a day or 2 days, fine, okay. What is going to be in between? Very, very, very important thing. revise the next day morning. Revise next day morning, take 1 hour. I've told you this already, the importance of this. Okay, revise next day morning, take 45 minutes, revise next day morning, and you're going to retain this 40%. Okay, you're going to retain this 40%, not for a long period, hardly for a week. Okay, you're going to retain this 40% by doing this revision. Most of the time you'll forget, most of the things you'll forget, but you'll just at least know the skeleton, or you'll remember the skeleton what you have learned. Fine. Now, at the end of the week, again for a smaller subject or for a smaller topic, you're going to have a subject-wise exam. Now, for microbiology, it's going to be delayed. Okay, but by the time, whatever it is, whenever you're going to get it, if you're following the same pattern, revising every day morning, you're going to retain. You keep on retaining this 40% till your subject-wise exam, which is going to come for microbiology. Okay, after 3 or 4 topics are over, you will get the first microbiology subject-wise exam. So imagine you're getting that. You're going to learn 10% more. Plus the previous 40 is there, huh? You're trying to retain it. So you're going to take, for example, one Sunday, you have a test paper. Don't do anything new. Just revise whatever is there for the exam. For example, you were revising bacteriology. You did, for example, you did bacteriology, immunology, and virology. But you have two topics to finish in virology in today's exam. Don't do that 2 topics. Whatever you have learned, do that, go for the exam. Okay, whatever is pending, do it tomorrow. You have a whole next months to come. So, the more important is to follow the pattern. If you follow and get trained to this pattern, it becomes much more easy. Learning becomes much more fun. Though you might not be very much up to date, but learning becomes a fun. Okay, so you do this, you retain that 40% plus you learn 10% more. Because you have the whole day, this is where it comes. The whole day you have been revising. So 10% more. You are not doing anything new, but still 10% learning is coming. Why? That's what the power of revision is. Okay, many things will go into your mind only after multiple revisions. Okay, now not over. After 4 subjects are over, like for example, microbiology is over, so you are continuously revising microbiology for your test papers. Like your first test paper is over, the second test paper week has started, so you are doing it continuously. You are not left it. You have a good chunk of notes. So every day morning, even if you have started anatomy, you just turn around the pages and see your microbiology. You are not keeping it there. When we start anatomy in depth, I'll tell you this. Okay, you shouldn't keep your microbiology aside. Just take your notes, run through it every day morning, just to see what you have learned in microbiology. Okay, till you finish your grand test for microbiology. Okay, means you'll be having a grand test which will combine microbiology, anatomy, orthodontics, and probably I think periodontics. So till you finish your grand test, you should keep on revising your microbiology and anatomy at least. Why am I saying it? Because the second grand test will include the next 2 subjects like orthodontics and periodontics. So at that time you should be more concentrating on ortho and perio and the next 2. So that's how it's called continuous revision strategy, which I'll go into depth later on. But now understand, because grand test is little far away for you now, but still, yes, grand test will take place and you're going to learn definitely 10% more. You're not doing anything big, anything extra, but you're just solving the test paper, which is going to give you this 10%. You have revised for the test paper, which is going to retain for you the 40%. Again, you solve your grand test, you're going to get 10% more from there, from your grand test, and plus you have retained your 50%. So how much has it come to total? This is 60%. Now, till your last revision phase 6 you can call it, okay, till your last revision phase, if you can retain at least 60% of what you have learned, you have done your job. We learn 20% more in the last phase. But your job is to retain this, keep on revising your notes at least, and do more and more question papers which you are going to get. Okay, so if you can do this at least, then you have done your job. In the last round, we'll learn more. Now, you tell me that only 80% of learning. What about 20? That means I am not, I'm competing with big people, and I'm learning only 80%. No, I want 100%. Take 5 years for that. You'll take 5 years for that. You can only learn. Remember I told you, no student can go for the exam with completing all the syllabus. Yes. If you have learned at least 70%, if you have learned at least 70 to 80%, you have done a wonderful job and you are there at the top. If you have done 60%, you're still there with a very high chance. Okay? If you have done at least 60%, still you are there with a very high chance. Anything below 60, question mark. Okay? So between 60 and 80 is what you can do in this coming year. That's why I told you, don't be over enthusiastic. You can't do beyond that. Anything between 60 and 80 is the key. And this is the pattern if you want to follow. Please follow. It's not finishing a lot of areas. It is training, getting trained in this way. It's not that many students make the mistake that they think that now Dental MDS Academy is a new academy, means I have to do more, because what I'm going to get from Dental MDS Academy is probably lesser, so I'll do more and I'll get more, and finally what they do is they end up in nil. We have our last year's topper. In the first year itself, we had 8 admissions into government dental colleges. Okay, in Dental MDS Academy, just follow what is being given to do. You don't overdo anything. Don't over concentrate on anything. If you can do this much, follow this pattern. That's very important. Now, many people don't do this. At the end, they used to tell, sir, I thought now I think that if I followed you, I wish I could have followed you. Or some people don't do this. In the last moment, sir, I'm very serious now. Just help me with that. And okay, definitely we can't discourage anyone. We help them. And finally, they come after the exam. Results were not so good. They say, sir, I followed you. I followed whatever you said. Did you take down your notes? No, sir, I didn't get time because I started only the last 4 months. Did you follow this pattern of learning initially? No, sir, I was not very serious before. But I followed you, sir. This is a joke they say. No, you have to follow from right in the beginning, not in the end. Okay, so please make sure you understand the learning pattern. Now, how much times have you revised already now? Your first revision is here. Your second revision is here. The third revision is here. Okay, and probably your first revision should be on the same day. Your first revision should be on the same day. You taken down the notes, you go through your notes. Your second, I would say this is. Your third, your fourth. Please note, learning comes only after the fourth revision. Confidence comes only after your fourth revision. When are you going to do that? After your grand test. So once you have done your grand test, we are going to give you more test papers. Okay, daily boosters and all those. That is where you feel like, okay, now I am able to answer everything. Still, you don't stop your revision. You should continue your revision, but learning comes only after your fourth revision. Fine. So that's it. Now let us go on to the more important part, which is the clinical features. Okay, we're going to start with the clinical features. Now, as I've told you about the clinical features, there are 2 important diseases note. One is systemic diphtheria, or you can call it as diphtheria. Second is cutaneous diphtheria. Okay, so the first is diphtheria. Okay, the first is diphtheria. We're going to say about diphtheria. Definitely due to diphtheria toxin, Now, here we're going to discuss the incubation period first. For some diseases, you have to know the incubation period. What is the incubation period? The period between, the time between the organism entering the body and the symptoms developed. So maybe some organisms enter the body and you get symptoms probably after 3-4 days. So that's called the incubation period. So here it is again 3 to 4 days. Okay, 3 to 4 days is the incubation period for diphtheria if they ask you. Now, types of diphtheria. The types of diphtheria, either it can be divided based on the site of infection, or it can be divided based on the severity of infection. So based on type of infection, that is the site of infection, it can be either the pharyngeal, or it's also called phaseal, which is affecting the phaseal pillars, or the pharynx. Okay, pharyngeal pillars of pharyngeal or phaseal pillars, or it can be laryngeal. Okay, it can be laryngeal. Fine. So those affecting the pharyngeal or phaseal is the most common type, and this is the most dangerous type. Okay, which is the most dangerous type or most fatal. Okay, the most fatal of the, now there is different other sites also, but more important two sites, most common and the most fatal. Okay, now if you go on to the next slide, the other type which you have to note down here is based on severity. Based on severity, you can divide to three types. One is the toxigenic or hypertoxic. Okay, it's hypertoxic, or other name is malignant, which is the most dangerous form. Okay, because it's based on severity, isn't it? Malignant. Then you have got septic type. Then you have got the hemorrhagic type. Just no other option but to by heart. So it can be hypertoxic or malignant, it can be septic, it can be hemorrhagic. Now, a few features which you have to note here. Hypertoxic, the most dangerous definitely. Okay, and it is the most important manifestation is adenitis, inflammation of adenoids. And this inflammation or swelling of the adenoids or adenitis is called a bull neck. So bull neck is a feature of, they can ask you, bull neck is a feature of diphtheria. Okay, and hypertoxic or malignant diphtheria where there is the adenoids are swollen. Septic, majorly you see the pseudomembrane formation. I've told you, isn't it? Pseudomembrane formation. And note that pseudomembrane, please note that the pseudomembrane formation is due to necrosis in that region. This bacteria comes in and kills the cells around, which causes necrosis. We will study what is necrosis, apoptosis in general pathology. But as of now, necrosis is just the bacteria, the cells get killed. Okay, so the mechanism of pseudomembrane formation is necrosis, and this pseudomembrane later becomes ulcerated in the septic type. So septic type, the most important is pseudomembrane formation. Hemorrhagic is very simple, it's generalized bleeding. Hemorrhagic, isn't it? Hemorrhage, bleeding from the pseudomembrane as well as generalized in the body. Okay, internal bleeding can occur. So it's hypertoxic, septic, hemorrhagic. In hypertoxic there is bull neck, in septic there is pseudomembrane formation, in hemorrhagic generalized bleeding. Okay, generalized bleeding. Now, another thing which you have to know here is systemic effects. Okay, so that was local effects or what happens in that particular place. Okay, now systemic effects and complications. Okay, the first important class, complication is asphyxia. Which is due to pseudomembrane. So what is asphyxia? Means breathing, can't breathe, the patient can't breathe due to the pseudomembrane which is blocks it is there in the pharynx or larynx, isn't it? So it can lead to choking of the patient. Now, can you name me one disease which is purely dental, or I would say it's associated with dentistry, and it has got pseudomembrane formation? One disease, ANUG. Okay, ANUG, acute necrotizing ulcerative gingivitis. Now, yeah, that's why You have to differentiate between the pseudomembrane of this and that. We'll study. Okay, this is very adherent, very leathery pseudomembrane. The other one is different. Okay, we'll study that when we compare them later on. Asphyxia. Now, second very important manifestation or very important systemic manifestation or complication is acute circulatory failure. Acute circulatory failure. That is, the circulation fails and heart stops and all those. Okay. Then you have got toxemia, or the manifestations of toxins in the body which gets into different organs, and where you have to know that three very important ones: myocarditis, I'll just write it here itself. Okay, myocarditis, acute interstitial nephritis, tubular necrosis you can call it as. So just write it down. Nephritis, that is, it affecting the kidney. The toxin goes and deposits in the kidney and the kidney gets damaged. So acute interstitial nephritis. Okay, and finally you have got polyneuritis, the nerves. Okay, polyneuritis. So the type you studied: systemic complications, asphyxia due to pseudomembrane, acute circulatory failure, and toxemia due to toxin. That is myocarditis, inflammation of myocardium, acute interstitial nephritis due to the toxins going and destroying the kidney, and then you have got polyneuritis, that is nerves are destroyed. Okay, nerves are destroyed. Then you have got cutaneous diphtheria. Okay, I just need to write it somewhere here. Cutaneous diphtheria. Just write it down. Not much. The only thing which you have to know here is in cutaneous, it's not due to toxin. Not due to toxin. Okay, or it is due to non-toxigenic strains. That means they are not due to the virulent strains or not due to the lysogenic strains. It is because cutaneous, just you will see a rash on the skin, and it is thus it's not due to toxin. And diphtheria, the normal diphtheria is due to toxin. This is not due to toxin, and it is just the direct action of the bacteria on the skin and the body reacting to it. Okay, so it's not due to the lysogenic strains. Why is it important here? Because I've told you, when you're treating diphtheria, you need to neutralize the toxin. When you're treating cutaneous diphtheria, do you need to neutralize the toxin? No. Just keep antibiotics. Just keep antibiotics. You don't need toxins. Okay. So I'll stop it here. We are left with lab diagnosis and the prophylaxis and treatment. Okay, which is again a little long topic. So I'll discuss it in detail in the next session. Fine.